FASENRA is indicated for the add-on maintenance treatment of patients with severe asthma aged 6 years and older and with an eosinophilic phenotype. FASENRA is not indicated for the relief of acute bronchospasm or status asthmaticus.
All his life, Rob had been a problem solver. This is why he enjoyed making a living in construction. When the doctors told him there was nothing else they could do for his asthma, he refused to give up. He knew there had to be something that could help. Rob came to us in a sort of last-ditch effort. Numerous doctors had previously told him that this was the best his asthma would be. At just 49 years old, he faced an uncertain future. When we first saw Rob, he was struggling with asthma attacks, shortness of breath, and his FEV1 level was around 40%. His previous doctors had him on multiple treatments: high-dose ICS plus LABA, LAMA, leukotriene modifiers, and rescue SABA, along with a nebulizer twice a day. And he was on a 20 milligram daily dose of oral corticosteroid. He was being heavily treated, but his asthma was not well controlled. Rob was in bad shape. Rob was allergic to dogs, and when we tested his eosinophil count, it was high, 1,064. I was not surprised that he had eosinophilic asthma based on his presentation. Rob had late onset of severe symptoms, was not responding to increasing doses of oral corticosteroid, and had a history of chronic sinus symptoms. He was also biologic naive. At this point, I thought he was a good candidate for FASENRA, and we got him started on a sample. Rob was my first FASENRA patient. I considered and discussed the risks and benefits with Rob, and in the end, we decided FASENRA was the right next step. After his first dose, at his next visit, I had a very powerful experience with Rob. I remember the moment so clearly. He was so grateful for the impact I had on him. Just 1 month after starting FASENRA, Rob's eosinophil count dropped from 1,064 to 18. Now, Rob is a different man. He doesn't need his daily oral steroids. He is not as worried about exacerbations, and we've seen a clinically meaningful improvement in his lung function.
Please stay tuned for some important safety information about FASENRA.
FASENRA is indicated for the add-on maintenance treatment of patients with severe asthma aged 6 years and older and with an eosinophilic phenotype, the treatment of adult patients with eosinophilic granulomatosis with polyangiitis, EGPA. FASENRA is not indicated for the relief of acute bronchospasm or status asthmaticus. Important safety information. Contraindications. Known hypersensitivity to benralizumab or excipients. Warnings and precautions. Hypersensitivity reactions. Hypersensitivity reactions, e.g. anaphylaxis, angioedema, urticaria, rash, have occurred after administration of FASENRA. These reactions generally occur within hours of administration, but in some instances have a delayed onset, i.e. days. Discontinue in the event of a hypersensitivity reaction. Acute asthma symptoms or deteriorating disease. FASENRA should not be used to treat acute asthma symptoms, acute exacerbations, or acute bronchospasm. Reduction of corticosteroid dosage. Do not discontinue systemic or inhaled corticosteroids abruptly upon initiation of therapy with FASENRA. Reductions in corticosteroid dose, if appropriate, should be gradual and performed under the direct supervision of a physician. Reduction in corticosteroid dose may be associated with systemic withdrawal symptoms and/or unmask conditions previously suppressed by systemic corticosteroid therapy. Parasitic helminth infection. It is unknown if FASENRA will influence a patient's response against helminth infections. Treat patients with pre-existing helminth infections before initiating therapy with FASENRA. If patients become infected while receiving FASENRA and do not respond to anti-helminth treatment, Discontinue FASENRA until infection resolves. Adverse reactions. The most common adverse reactions, incidence greater than 5%, include headache and pharyngitis. Injection site reactions, e.g. pain, erythema, pruritus, papule, occurred at a rate of 2.2% in patients treated with FASENRA, compared with 1.9% in patients treated with placebo in asthma exacerbation studies. Use in specific populations. The data on pregnancy exposure from the clinical trials are insufficient to inform on drug-associated risk. Monoclonal antibodies such as benralizumab are transported across the placenta during the 3rd trimester of pregnancy. Therefore, potential effects on a fetus are likely to be greater during the 3rd trimester of pregnancy. Please read full prescribing information, including patient information, at FASENRAHCP.com.